All right, we're going live on all platforms. Hey, I have no idea if this is working, Z-Pack. I'm going to check it out. It's Dr. Zubin Damania here, Z-Dog MD if you're nasty. And I think I am live on both Facebook and YouTube for the first time ever, perhaps the last time if it doesn't work very well, which I am concerned about. Anyways, come on in. I'll be able to look at your comments here on both platforms. I'm using a new space, new technology to do this, and I'm doing it all myself because social distancing. Thank you, COVID, for forcing me to be my own tech support. All right, guys, let's see. Yep, it looks like it's working, sounding good and looking good on both platforms. Callie on YouTube says, hey, Dr. D. Jody Chance, who's a supporter on YouTube, says, hey, what's up? Going over to Facebook, we have DJ Young, Melissa, Nadia says, thanks for being awesome. All right, let's dive into it because clearly I think it is working. All right. News today on the COVID front, okay? And by the way, I don't know about you guys, but I'm tired of COVID. I'm tired of it, but it's irresponsible to be tired of it. I just am tired of it. And so, but I do want to address a few things. Okay, the first thing I want to talk about is the early peek at the data of remdesivir, the antiviral drug produced by Gilead. Now, a lot of hype and a lot of hope has been put into remdesivir as an antiviral treatment. And the idea is it actually inhibits the viral replication. I mean, it actually harms the virus directly. And the idea then is that you can give it to sick patients and maybe less sick patients and prevent them from dying or becoming more sick. It turns out, so far, looking at about 125 patients in a Chicago series, and again, this is just an early peek, understanding the main limitation of this trial, which we're going to talk about in a second, looking at those patients, so far, what they're seeing is these are sicker patients, so the vast majority of them are severely ill in the ICU. Turns out they're actually doing quite well. So they're getting extubated, they're being discharged. There were a couple of fatalities in the series, but that is less than what you would expect given the number of patients and the severity of their illness. They ran it by Eric Topol, who's been on the show a couple times at Scripps, and he said, the early data is promising. So that's actually really encouraging, but it's still, here's why we should temper that with some reality of how the science works. First of all, it isn't published yet. It's just an early peek at a signal from the data that, hey, this may be working. But the biggest problem here is we don't have a control group. So this is not a placebo-controlled trial. It's looking at patients who got the drug and seeing how they did. Now, you could compare them to a matched cohort that got sick at the same time, but it's not the same as doing a placebo-controlled trial where one group is randomized to getting a placebo and the other is getting remdesivir, because then you could compare the two groups, match them, see if there are any pre-existing differences between them, and if there's not, especially if the trial is blinded, then you get a really strong signal, right? But we don't have the luxury of doing that right now. Now, it's a small series that they've released the result for. The bigger series is something like 2,500 patients or something across the globe. And that'll be interesting too. Again, not placebo-controlled, but at least we'll get a sense that would allow, if remdesivir is working without a lot of side effects, so I know there's some liver toxicity and things like that. Also, what's the duration of treatment? So if, so far what they found is, well, they were shooting for a 10-day duration, but the patients were getting better and getting discharged before that. And it's an IV drug, so it's like, well, okay, we'll just stop giving the drug. And so the idea is maybe it's even a shorter course. The other question is, can you give it to moderately ill patients to prevent them from progressing? Does that help? And again, what's the side effects and toxicity going to be of this drug? Ultimately, what will the cost be? And then let's say that the trial actually shows a good benefit. What will the FDA do to expedite its use, given, right now it's under the so-called compassionate use, but in the trials, they have broader inclusion criteria. So I think it's going to be really interesting to see, and it's actually rather encouraging in the broad spectrum of things to see an antiviral that can work. And the reason that I'm particularly encouraged by antivirals is that I'm more discouraged about vaccines right now. I think, having talked to Paul Offit and others, it's just a challenge to get it done quickly. And if we're hanging everything on, oh, we got to get a vaccine before we can get back to work, we're going to be screwed, all right? So we can't do that. We have to look at all the other avenues. Now, that gets me to the next thing I wanted to talk about, and then we'll look at some comments and questions. Let me make sure YouTube is still streaming. It looks like it is. Callie asks on YouTube, can remdesivir even be obtained for hospitals? So there's protocols to obtain it. I know that sick patients are getting it at many of the hospitals that I've been contacted about. So that being said, let's go back to what I was talking about, which is, I think today Trump said, okay, let's figure out ways that we're going to get the economy started. I'm going to put it to the governors. We're going to use, some method to figure this out. Who knows what the heck he's talking about? But here's what I think needs to happen. To get the economy spun back up, get people out of lockdown, we need to make sure, at the least, right, that we have an ability to test people when the recurrence inevitably occurs and stamp it out, which means you have to be able to test people accurately. You really do want to spin up antibody testing in people who may have been exposed previously or have been sick previously, and to document that they have antibodies. We still have no good data saying that those antibodies that people develop are actually protective against getting reinfected. We just don't have that clear data yet, or at least I have not seen it, which means you can get the disease, you can show antibodies to the virus, but are those antibodies the kind of neutralizing antibodies that actually would prevent you from getting sick in the future? Now, there's lots of circumstantial and early data that seems to suggest that the answer is maybe yes, but we need to see that, because then you can start testing broadly in the population and say, hey, you've been exposed, you have antibodies, you're good to go. Here's a little card that says, you've already been exposed, which I think is very helpful, particularly when you're talking about healthcare workers too, right? Because the level of anxiety, remember this is something that's very important. Somewhere between 10 and 20%, depending on the data you believe, of all infections since mid-February until April 12th or so in the US, 10 to 20% of all the COVID-19 cases are healthcare professionals. We are at the highest risk of, like any group, of contracting the disease. And it's being contracted majority women in that group, because I'm suspecting because of nursing. And it's younger people, because again, it's the demographic of healthcare. So, we're going to need to make sure that we focus on those guys, especially in trials, which is why I shared the HEROES registry out of Duke and PCORI that is looking to enroll healthcare professionals in things like, hydroxychloroquine trials and other registry data to study frontline healthcare workers, because they're at the highest risk. So we need to get that data, but then we need to be able to test people if we're going to start spinning the economy up, because then when we have a suspected case, and including screening asymptomatic people, when we have suspected cases and screening, we can then quickly do the next thing that we require, which is tracing their contacts. And there's technology that can hopefully help with that, based on cell phone GPS, things like that they've used in other countries. And then isolating just those people, because that has shown to be effective in places like Singapore, South Korea. Aggressive testing, aggressive contact tracing, aggressive focal quarantine, and then a broader admonition to people at high risk with chronic disease, the elderly, to continue social distancing, as hard as it is, because they're at the highest risk of having mortality from the disease. Now, all that being said, I think we ought to start really looking at this quickly, because I have, and again, this is pure speculation on my part, but I think we're seeing the hump, especially in the biggest hotspot places like New York, et cetera. And we're going to start seeing this thing, as the weather starts to warm up, really peter out. And I think the harm that we're doing now to young children, to people at economic risk, to the economy, is going to start to outweigh the benefit of full lockdown, which means let's think of it this way. Okay, let's just really think about this. If you believe some of the numbers, okay, let's say we drop the GDP by, we've cut like 50% economic output. Let's just throw a number out there. That's something like $25 to $50 billion a day of economic output that's lost. So we ought to be spending at least that much to science the crap out of this and spin the economy back up. Because otherwise, I mean, this is the opportunity cost of doing nothing is $25 to $50 billion a day in lost economy. Now, what does that mean? It means people losing jobs. It means even healthcare professionals specifically being furloughed because, all the elective procedures are gone, which, by the way, that shouldn't be a source of, why are we relying on that for our livelihood? It's crazy, right? We need a broader base in how we're paid as healthcare professionals. We ought to be paid to keep people well. And that's a whole nother discussion. And so we ought to be spending money on sciencing this up, contact tracing, developing the technology to trace and quarantine. And that ought to be priority number 1, 2, and 3, as well as studying the antivirals like Gilead's remdesivir, which we're doing currently. So I'm actually pretty encouraged. I'm feeling like, and again, this is all elephant, right? I'm feeling like, after my rant the other day where I was like, we are losing our damn minds. I still feel that way. But at least now we're starting to say, all right, let's look at actually cold, hard data and stop relying on, all these models that you tweak one input and suddenly the outcome is like, well, is it 1 million dead or is it 20,000 dead? Oh, it depends on whether you tweak one bit in the input here. Right? So let's be really clear-headed and rational about how we're looking at this stuff and start to implement these plans. All right, let's look at some comments. And by the way, one other thing I want to clarify, there's so much misinformation, you guys, on the internet. I get sent so much stuff. Hey, what do you think of this? 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 And I've said this before, I'll say it again. People like, naturopaths and chiropractors, they really shouldn't weigh in on fighting a coronavirus unless they're saying things like social distance, unless they're saying things like, hey, you know what? Actually, good nutrition and exercise can help build your immune system, so you're in better shape if you get it. But things like, hey, drink tonic water and, take elderberry, whatever they're saying, just don't. It's not going to help you, okay? But one thing that will help you is continuing to be mindful of your hand hygiene, how much you're touching your face. Let me say something about masks for a second, and this is very controversial, just because I want to dive into that because it pisses me off. And I hate it, and I need to talk about it, or I'm going to cry myself to sleep. If everybody had surgical masks and everybody was required to wear them, we would see a decrease in transmission because anybody who's sick would not be able to expel enough aerosol droplets to make it a problem. The problem with our current mask situation is, first of all, everybody doesn't do it. Second of all, you can't have surgical masks for everyone because we don't have enough. You need to save them for the frontline healthcare professionals, okay? Next, if you're telling people, okay, we mandate you cover your face in public if you're going to go out, and people are using crappy cloth stuff, the danger there is, number one, they get a false sense of security. Number two, depending on the cloth, it's like super porous to virus particles. It's not going to help you that much. And so you're walking around getting in people's faces. You're not doing the social distancing because you think the mask is doing something. It's not doing anything. The third problem is you're touching yourself with the mask all the time, adjusting it, doing stuff. Man, and so these edicts feel like we're just giving people a placebo, something to do. The problem is when you're yanking people off a, Philadelphia bus for not wearing a mask. And it's like, okay, come on, guys. Like, let's be really careful. Now, in New York, where you have super density, maybe you need a mandate that says, hey, you know what? Get everybody in New York a surgical mask. Of course, we don't have the resources to do that. And yeah, it would help, right? So no denying that. But the data for out in the wild cloth masks helping a situation like this, That data doesn't exist. It just doesn't exist. Okay, it's based on a lot of really crappy data that doesn't really apply to the question we're asking very directly. All right, so let's get that out of the way. The second thing is, if you're wearing gloves in public, you're just an idiot. The gloves, okay, you're walking around touching things with the gloves, then you're touching your wallet and you're touching all this stuff. Who is that protecting? Is it protecting you? Maybe a little, unless you're touching stuff with your gloves, which everybody does. You can't wash your gloves, so it's worse than bare hands, because at least you can wash and sanitize with hand sanitizer your bare hands. So people walking around with gloves, it's kind of like, this is just another dumbass move, all right? We ought to be educating better about this stuff, and I don't think we've done it. I don't think we've done it well enough to say, oh, people are getting it. All right, let's read some comments. Risa Dubois on Facebook says, more education on how to wear a mask. Right. How do you take it on and put it off? You don't touch it here. You pull it off by the little doohickeys, the straps, right? Don't use it as a mechanism to say, oh, I'm just going to keep adjusting it and touching my face and touching my eyes and all that, because people do that. It's a problem with messaging, because people don't have the same level of education as a healthcare professional, and even the healthcare professionals screw it up all the time. The studies show that nurses in ICU touch their face like 20 times an hour while they're wearing a mask. So even we don't wash our hands really good, especially doctors are particularly filthy about this. So we have to do better. And then, how do you feel about wearing the same mask for 6 shifts, Tracy Scott? I don't feel good about that at all. The only reason we're doing that is we don't have enough masks. But even that, now we've had a delay. Now, there are a lot of facilities that are reporting back to me that they're getting PPE in. I know Stanford has enough for now. They're giving surgical masks to everyone who walks in the door to wear while they're in the facility. So my wife goes in there as a radiologist, puts on a mask, and they give you a little brown paper bag to store it in and keep it safe during the day. Now, again, what's the data? We don't know. The South Korean or the Singaporean, I forget whether it was South Korea or Singapore, they were showing that surgical masks worn by healthcare professionals that also kept social distance within the hospital and washed hands aggressively and disinfected surfaces through environmental services did quite well. They had really minimal nosocomial hospital-related transmission. Let's go to a YouTube comment or two. Dicom Rules in Texas, who's a supporter on YouTube, says everyone should try gloves and radioactive doses, LOL. There it is. Beth Marie, 44 on YouTube, says, just got home from the store watching people in gloves and masks that kept pulling the mask off and on to talk and answer their phones. This is the thing. When you see someone doing this and they're wearing a mask and gloves, just call the code. At that point, it's just apocalypse now. Like, we're just done. So that's what I wanted to rant about a little bit today. All right, guys. So tell me, leave in the comments here, how do you think this simulcast went? Is this something I should do, both YouTube and Facebook? Is the quality good? Because I'm using a fiber optic connection in this new studio. And should we continue to do it? If so, hey, great. Leave a comment, share the videos. We'll keep talking about this stuff until we're blue in the face. And do me a favor, become a supporter if you can on either platform. It really helps us. Send us some stars. That helps support all this. And when Logan's able to travel again and Tom's able to travel again, we'll have them back here, and it's going to be awesome. You guys, stay safe out there. I think we are going to see better days soon. I really do. I really, really do. I honestly believe that. So take heart. I know people have been terrified. People have been traumatized. People have been made so anxious. I get messages from people that just say, I am a mess. Not me, although I am a mess. They're a mess with anxiety and freaking out. So there's going to be a surge in mental illness. We really are going to have to pick up the pieces and be stronger after this. And by the way, Health 3.0 is coming because we're demanding it. So stay tuned. By the way, if you haven't seen our new kitty nurse Metamoji, check it out. It's kind of wacky funny. All right, guys. I love you. Now I got to end both streams. YouTube first. Bye-bye, YouTube. I love you.